Welcome to Dentists Behaving Badly. I'm Dr. Tony, a dentist who has been in practice for over 20 years. I'm selecting articles from the internet of instances of dentists who have made the news for acting up and others who have found themselves in bad situations. Sometimes good intentions turn into something bad, other times the intentions were bad from the beginning. The link for the source article for today's story can be found in the description box. Also, I'm not trying to embarrass anyone or put them on blast, so I only use the initials of the accused in the video. The identity of the accused can be found in the source article, which is in the description box. Today is another fraud case, found in DC News Now, posted February 9th, 2024. Former Maryland dentist sentenced to stealing more than $8 million from Medicaid, Baltimore, Maryland. A judge in Prince George's County sentenced a former dentist from Montgomery County for stealing millions of dollars from Medicaid. The Maryland Attorney General said that Dr. T of Potomac, Maryland, received the sentence after he, who was accused of stealing $8.5 million from the Medicaid program, pleaded guilty to charges on February 6th. The charges against him were defrauding a state health plan, the Medicaid program, and practicing dentistry without a license. Prosecutor says the dentist defrauded the program by practicing dentistry without a license on Maryland Medicaid recipients and using the names, provider numbers, and professional credentials of licensed dentists to submit claims. In the majority of cases, the patients were children. The Attorney General's office explained that the Maryland Medicaid program is a joint federal-state program that gives health care benefits to people who have low incomes. It added that the dentist received payments for services that were billed fraudulently under the names of 4 other providers. Some background. The Maryland Attorney General's office said the doctor had been licensed to practice dentistry in Maryland since September 1994. He and 2 of his brothers owned several dental practices. By 2015, they separated ownership of the practice. This dentist in question retained ownership of the practices in Greenbelt, Maryland, and in Rockville, Maryland. The Maryland Board of Dental Examiners, suspended the dentist's license to practice dentistry in March 2014 after it received several complaints from his patients. The board found that there was a substantial likelihood that he posed a risk of harm to public health, safety, and welfare, according to the Attorney General's office. The board revoked the dentist's license to practice in dentistry in February of 2015. That was after it found that he kept consistently incompetent and egregiously deficient dental records. Additionally, the board said the dentist gave patients incompetent and substandard treatment, billed for service he didn't provide, and conducted himself in unprofessional and dishonorable ways. The scheme. Despite his license being revoked, prosecutors said the dentist continued to own practices in Greenbelt and Rockville from 2015 through January of 2023 and practiced dentistry on Maryland Medicaid recipients. They added that the dentist stole the identities of other people, forged signatures on Medicaid applications, used aliases to avoid being caught, told his employees to use aliases, and didn't cooperate with insurance audits. Prosecutors said that the dentist wrote notes. He signed them Dr. T, which kept things vague, so it could have been any of the brothers who signed the notes. Prosecutors said he continued to bill for services he did not provide, deliver substandard care to patients, use equipment that was not sanitized properly, perform and bill for unnecessary services, including root canals, fillings, and tooth extractions, bully and intimidate patients who questioned him, kept very little documentation of services he claimed to have provided. The Maryland Attorney General's office summed up the situation by saying, Dr. T's practice of dentistry continued to fall below professional standards, resulting in pain, suffering, and infection to children with Maryland Medicaid health insurance. The money breakdown. Prosecutors said that from 2015 through 2022, the dentist submitted claims for payment to Medicaid using the names, Medicaid provider numbers, and credentials of his twin brother, his younger brother, and his nephew, all whom are licensed dentists. The dentist also used the credentials and Medicaid number of a former colleague to submit fraudulent claims to the Medicaid program. The Maryland Attorney General said the dentist received $416,850 for fraudulent claims filed under his twins' credentials, $3,143,975 for fraudulent claims filed under his younger brother's credentials, $4,751,127 for fraudulent claims filed under his nephew's credentials, and $218,950,000 for fraudulent claims filed in 2 months after under a former colleague's credentials. The sentence. The dentist received a sentence of 5 years, but the judge suspended all but 78 days. The judge placed the dentist on 18 months of home detention with a 5-year term of probation for Medicaid fraud count and to 1 year in jail suspended, followed by a 5-year term of probation for practicing dentistry without a license. The sentences are running consecutively. The dentist is also to pay $8.5 million in restitution within 1 year of receiving his sentence. At the time of sentencing, the dentist made one $4.5 million payment toward restitution. The dentist cannot provide health care services that are either partially or wholly funded by state or federal governments and has to give up his Maryland dental license permanently. This is just a gross miscarriage of justice. He only received $78 in jail and pay back money that he has already stolen. Someone needs to investigate the judge and everyone else on this because, like I said, it's just a gross miscarriage of justice. There are a lot of people in jail for less that have spent way more time in jail for a lot less. Most dentists endeavor daily to use their skills, talents, and social standing as doctors to provide outstanding care to their patients and serve as role models in the community. A small group of others allow entitlement, greed, and personal proclivities to overshadow their responsibility to their patients, the profession, and society.